Hi, my name is Ressi. I'm an occupational therapist and certified lymphedema therapist. Today I'm going to show you how to perform manual lymphatic drainage, or MLD, along the face and the neck to address swelling or lymphedema. We have lymph nodes in our body and clusters of them along our neck region and our armpit. Those lymph nodes act as filter stations to help fight against infection. If you've had surgery along the face or the neck or the throat for cancer, you may develop swelling along this region of the face and the neck. I'm going to show you techniques and methods on how to redirect the fluid to avoid the fluid buildup or swelling. We begin by doing diaphragmatic breathing, which is helpful in improving circulation of the lymphatic system. It's not a chest breath, so I'm not going to take a deep breath and go. When you do diaphragmatic breathing, you want to see the stomach expand. So you're going to place your hands on your stomach, take a deep breath in through your nose, and watch your stomach expand. When you exhale through your mouth, your stomach will fall in. Repeat that 5 times. Deep breath in. Exhale out. Think about a 4-second inhalation and a 4-second exhalation. Deep breath in, exhale out. Now we can begin by clearing the area along the chest. As I mentioned, we have lymph nodes in the armpit region and in the neck. But if you've had surgery or radiation treatment for cancer in those regions, we're going to redirect the fluid to drain toward the armpits. If you had surgery on the right side, we're going to start with the left. And if you had surgery on the left side, we're going to start on the right. So today I am going to start on the left side. I'm going to place the palm of my hand in the armpit, and I'm going to move the skin in a circular pattern. 5 to 7 repetitions. Lymphatic massage is a light touch movement of the skin. It's not a deep tissue or deep muscle massage. You're moving or stretching the skin to open up channels so that the fluid can move more freely. So I'm giving it a little bit of a pressure moving toward the armpit. I'm going to come up a little bit higher to stretch the skin. 5 to 7 repetitions in each area. And notice how I'm not using my fingertips or my thumb. You can see the indentations on my skin. I'm just using the flat part of my hand and fingers to move the skin in a direction toward the armpits. I'm going to come up a little bit higher on the neck. We call this the circular pattern. You can do another method called the pump, where I stretch the skin and I let it go. I'm not doing a deep or long stroke. I'm not petting the skin. I'm stretching the skin. So I'm trying to clear a pathway toward the armpit. Then I'm going to come up along the collarbone where we have lymph nodes along this neck region. And again, perform my circles, 5 to 7 repetitions. You can alternate with the pump technique where you stretch the skin. You can form a V with these 2 fingers and come behind the ear and also move the skin along the side. come along the chin, followed by the pump. Then you're going to make your way to the face. You want to cover as much surface area along the armpit, the chest, the neck, and then the face. Then you can move on to the other side. Circular movements in the armpit, 5 to 7 repetitions. Come on the chest. I'm pushing the skin in a downward direction. A little bit closer to the neck and the collarbone. And then your pump. Pull the skin and let it go. Come along the neck. The chin. You can even go as far to the back as possible. Again, you want to cover as much surface area as you can. And the face. First the ear. And then the face. Take your time with this technique. You can spend up to 30 minutes to clear all the pathways of the lymphatic system. You can go back with both hands. If it's more comfortable for you, you can cross your hands. But again, use the flat surface of your fingers or the palms of your hands. You're stretching the skin in a downward direction toward the armpits and toward the collarbones. If you have had surgery for cancer or plastic surgery that has left you with a scar along the neck region, you may apply a deeper pressure to get the scar to move better. This is when you can use your fingertips. If you had a scar along the neck, you're going to use 2 fingers and apply a deeper pressure so that you may see the skin move. Make sure that you have been cleared by your doctor to mobilize the scar. If you've had treatment for cancer with radiation, sometimes that may cause a thickening of the skin, which we call fibrosis. If you have a thickness of the skin anywhere along the neck or the chin, again you may use the 2 fingers for a deeper pressure, giving it a circular pressure wherever it feels thick. The idea of both techniques are to ensure that the skin is mobile. You want to be able to see the skin move. Sometimes scar tissue can cause an adhesion where it sticks to the underlying tissue. Or if you have that fibrotic tissue where it feels very thick, it doesn't move very well. That is when you can use a deeper pressure with your fingertips to get the scar or the fibrotic tissue to move. But again, with lymphatic movement. You want to see the skin move with a more gentle pressure by stretching the skin. If you found this video helpful, please subscribe so that you may view more content. Thanks for watching.